testing and double-checking each piece of life-saving equipment. The critically ill COVID patient is more than 150 miles away. This team of specialists in Aberdeen pack for the complex transfer from the Central Belt.
We've just taken a phone call for a sick patient who has coronavirus, who is struggling to be managed with conventional means, and so the team are just in preparations to mobilise and travel to that patient to place them on ECMO and bring them back here in Aberdeen for treatment.
On the trolley is an ECMO machine, a life support system that takes over the function of the heart and lungs for those in organ failure. To benefit from this treatment, there is a strict criteria. There are only 6 ECMO beds in Aberdeen Royal Infirmary. 5 are currently being used to treat COVID patients.
We have always had a steady ECMO referral from across the country. I think we're seeing that increase over the last few weeks, and as we run into winter, we're seeing the phone calls for that service increasing in number.
The centre in Aberdeen has been part of a UK network offering ECMO for the last decade. It took over the running of the service for the whole of Scotland in April. This was during the peak of the first wave of the pandemic, when pressures were placed on all levels of NHS care.
Tired is how I would describe it. You know, the adrenaline in the first wave kicked in and kept us all going. We're all feeling it. You know, all the girls and the staff that are in our COVID pod, and they're in there day after day. It's tough going, and there's no sight to when this will end.
A letter signed by all 4 of the UK's chief medical officers warns this winter will be gruelling for the NHS. They call for a sustained response from the whole profession.
We don't have the same number of cases that the Central Belt do, but it's still here, and it's been tough going.
Elsewhere in this hospital, an outbreak of the virus affecting both staff and patients led to the closure of a ward to new admissions. This is a situation other NHS boards also face, and maintaining infection control and staffing levels will remain a challenge in the months ahead.
Flu season for us is always difficult, but how do you is this a COVID patient? Is this a flu patient? You know, until we get swabs and results back, we won't know, and it'll be really difficult for us.
I think the announcement in regards to the vaccine in the last couple of days has probably made a little bit of a difference, and there's a glimmer of hope on the horizon. The numbers that we've seen so far have been stable, and we're hoping that we can keep it that way through the winter time, but we are prepared for the worst.
Those preparations have enabled this team to respond twice in the last 24 hours to transfer patients in need of this life support. Sharon Frew, STV News.